Hi, Jamie. Hi, Bambies. Thank you for joining me. Thank you for all the blue hearts, Jamie. All righty. So I'm actually early. I'm on time. It is, hi, Gabrielle. It is 7:29. Hi, Jennifer. Hi, Joanne. All right. Okay. So this is my once a month live episode for February, even though I was live a couple weeks ago, I think. Um, was I live a couple weeks ago? Yeah, February 1st was my first live. So this is the second live. Y'all get a bonus live this month. So here I am. Hi, Miss Sandra. Hi, Carla. Hi, Pamela. All right, so this live will be like most other lives. If you have any questions, I will say this. Please make your questions specific and not general. How do I get started? I won't answer. How do I get started? What books do you recommend? Because that is all over the place on my channel. Look through the videos. Okay, so there's lots to discover. Trust me, I have tons of videos. I have over 1,200 videos. And if you say, well, it's just too much for me to look through, well, then keep looking because I won't answer. So, but if you have any other questions, anything that's thought provoking, I'll answer it. So just leave them in the comments there. Hi, Ambrose. But tonight, I filmed an episode earlier, so just in case y'all don't catch it, I was talking about remote medical coding, and of course that always it's a hot button topic. People get all excited about, oh, remote medical coding because they think it's like the best thing in the world, especially new coders who don't know about the field when they get in. So I'm going to be talking about that here in a minute. Hi, Crystal. All right, so since we have plenty of people in here already okay. We'll go ahead and get started. If you're brand new to my channel, welcome. I am Blue. I'm a medical coder. This is my once a month live, so I am live speaking to you. So if you have any questions, thought-provoking questions, leave them in the chat and we will discuss. Other than that, I will do some housekeeping first, though, just so you guys know. My calendar is completely booked for the rest of this month and into March. So April 1st is actually my very next availability. So if you are looking for your resume to be rewritten, or you're looking for tutoring or professional coaching or any of those things, interview prep, that won't be available with me until April the 1st. So just message me. My contact information is in the description box along with my rate. Okay. Do programs offer externships? So externships are typically with the colleges, like when you are in a college program for medical billing and coding, or you're in one of the degree programs, that's typically what the externships are. You do not need one in order to get a job as a medical coder or even a medical biller. So that's what I have to say about that. So Bambi's says, when you take the certification, could you use the 2023 books and pass? Let me ask you this, what certification exam are you taking, Bambi's? I want to sneeze, that's why I keep all of a sudden I want to sneeze. The whole time I'm sitting here, no sneezing, and all of a sudden now I want to sneeze. So let me know what test you're taking. And when are you planning on taking this test? I know medical coding, honey, but what certification are you taking? Hi, Liz. All right, so I'm not available until April 1st. Everybody knows that. Also in March, let me look at the calendar. In March, from the 4th through the 8th, well, actually from the 4th to the 7th, because that's my typical show times. Monday through Thursday is my typical show days. I will not be in the chat. I'll still premiere the show so that way you guys can talk. I will have somebody on moderator duty, but so that way there's no any craziness that goes on in the chat. but I will not be there. Okay, so from March 4th through the 7th, I will not be at the live shows. So don't panic. I need time for me. Okay, so I'm just gonna leave it there. For the Bambies, what certification exam are you taking? The CCS, the CCA, the CCSP, or the CPC? Which one of these are you taking? But I'll be back, Liz. Don't worry. So that's what I want to say about that, so everybody knows. Okay, so you heard it from me, but I will post again from March the 4th to the 7th. I will not be on the lives. Okay, and again, there will be a moderator on duty, so no tomfoolery. Okay, I'm just saying. All right, so let's talk about remote medical coding. So I do have a show for Monday talking about this, but I want to talk about it now while I can catch all of you live with me. If you are brand new and medical coding is what you want to pursue because you want to work from home, and you want to work from home because you have a bunch of kids, and maybe you have a newborn baby and that kind of thing, and you say that you want to do this because you want to be able to have a good job working at home. Well, the thing about medical coding at home is that there's higher standards when it comes to productivity and, of course, with accuracy. And if you have constant interruptions, because you can't treat it like you're at a daycare center and then all of a sudden you're trying to work, because that's not going to work. When you need to concentrate, you need to concentrate. These records can get very intense and they can get very detailed, and you have to be paying attention, because otherwise you can mix up words and then get the wrong codes and then get the wrong procedure code and then everything's gone. So that's the thing that you have to know. This is not an easy job. If somebody's telling you that it is easy, they are lying to you, to your face. So that's what you need to know. Medical coding is difficult. I don't say this to scare people, although I always get the messages afterward, you scared me, I'm scared of you. No, I'm not telling you this to scare you. I'm telling you to prepare you. Because if I was like these schools that are trying to sell a program, oh yeah, it's so easy, that the codes are already selected, all you have to do is just push it on through, AI and the electronic health record, they're already coding it. A lot of times it's wrong. Because why? AI is technically dumb, because it's an algorithm and it's looking for specific words and specific things, and it's not always correct. Okay, like a lot of the times it's not even correct. So that's the thing that you have to know. You have to be able to critically think. And not all providers document the same way. They do not use the same language. They do not use the same cadence in their writings. So that's the thing that you need to know. And there's a lot more to it than just working at home. And it does not matter if you have been a nurse. It does not matter if you have been a doctor before. I got a message from a doctor that lives in Mexico, but they're a retired dentist and they still live here. They still have a house in the US and they want to be able to live abroad and be able to code. No, that does not work, because a lot of times these companies want you to be within a certain radius so that you can come in for meetings, or if it is fully remote, they still want you to be in a certain area. They don't want you overseas. Okay, so that's the thing that you need to know. It's not all cut and dry like y'all think. And it's just the, I don't know, it's just those unrealistic expectations that's just driving me nuts lately. I don't know where y'all are getting that from, but I mean, it's just unrealistic. And then they're saying, well, I don't want to waste my time because I was told that if I didn't have 3 years of experience that I wasn't going to be able to work at home remotely. See, before the pandemic, yes, that was the case, right? Where if you did not have any experience, you were not working at home remotely, period. Then the pandemic happened, and then yes, now we have to at the time. And so now everybody's going back to work, but there are some places that are still hiring new coders to work remotely. However, the thing about it is that you still need to bring your A game. You cannot come in with some Mickey Mouse knowledge of barely knowing medical terminology and anatomy and patho, and barely having an understanding of the coding guidelines, and then still expect to work at home remotely, because they're still going to expect you to be able to meet production. Okay, they're still going to be able to expect you to do all these things. And learn the electronic health record. I'm just saying. Let's see. What do we have here? Blair says, a 5-year coding veteran, your videos helped me to gain the confidence to land a new job. That's awesome. And I'm now terrified because I need to learn the common modifiers used in the emergency department. Is that what you mean to say, Jennifer? So Bambi's, with the CPC, you can use the 2023 editions into 2024, but they say that you can do so at your own risk. So what they mean is, if there's a code that was updated and the test is testing you and you can't find that code in your book because it's been updated, so you're basically kind of going in, blind, because you don't know what that code is, then you're just taking a risk with the 2023 editions. But you can absolutely use them in 2024. So if that's what you have and you want to go ahead and take a risk, then yes, you can use those. The codes did have some updates, and some people will make note of that in their books, and so that's what I've heard. AAPC, they're okay with that, I guess, because that's what that's what I've heard from their people. So if that's what you want to do, look at the updated codes and then kind of make note of that. It's up to you. But yes, you can use those. Michelle says, hi Blue, I'm planning to take the exam CPC next month. I heard there's some of the questions that are fill in the blank. I have not heard the date, or if they're already doing it. No one's told me yet. I do know that they were slated to have the fill in the blank this year. It is only going to be a portion of the test. There's still going to be multiple choice. So I talked about this a few episodes ago, since you may be new because I'd never seen your name before. I did talk about how to prepare yourself for that, how to prepare yourself for the fill in the blank test, which is when you have your workbook, you should be not looking at the multiple choice. You should actually be studying and looking up the codes yourself. So that way, when you can compare them to the multiple choice, then you can see if you're on the right track. And if not, this will help you to know where you have to study. Since you have a month to go, like you said, you want to make sure that you're doing your 20 hours per week. It doesn't matter if you have a full-time job. It doesn't matter if you have kids and a family. You can fit 20 hours a week in for your studies. I'm just saying. But if you do that, and you've been consistently studying, you should have nothing to worry about. I'm just saying. Jennifer says, emergency department. My current company does not allow coders to add the modifiers, so I'm super rusty. The modifiers on the procedure codes or the modifiers on the E&M, Jennifer? Cami says, considering studying for the CCSP instead of the CCS. I see most jobs are looking for the CCS or the CPC, though. So would I still have the qualifications to apply for those? Yes. The CCSP is the outpatient credential. It's like the CPC. It's the HEMA version of the CPC. They are not comparable though, but they both cover outpatient coding. They're different tests completely. Okay. They both cover outpatient coding, but they are completely different in their design, is what I mean. Meds Coder says the testing strategy doesn't work with the real world assessment. I'm just saying. Favored says, will this live stream be available for future viewing? Lots of valuable information. Yes, I always leave my lives up because it takes energy to do these lives. So that's why I go ahead and leave them up for people who want to watch them later on. So yes, but that's just what you guys got to know. If you are studying for the CCSP, if you want to take that, I have it. Lots of people have it. And there's lots of job listings that do ask for it. And again, this goes back to people really not understanding the credentials and what they are and what they're about. Because people will ask for the CCS or they'll ask for the CPC. These are not the same. CCS and CPC are not the same. The CCS is the mastery. This says you have mastered inpatient and outpatient coding. This says you know how to code with ICD-10-CM, the CPT book, and the ICD-10 PCS book. The CPC says that you know how to code with ICD-10-CM, CPT, and HCPCS. That's all that's covered on that test, okay? So the CCS says that you know inpatient and outpatient. You're much more versatile this way. But a lot of CCS holders work in the outpatient setting. I have the CCS and I work in the outpatient setting. I also have the CCSP. I got the CCSP before I got the CCS. So the CCSP says you've mastered outpatient. That's what that says. So it is a great credential. A lot of people still ask for it. So why not go for it? That's what I'm saying, you know. Liz says, thank you for that E&M video, Blue. I searched for it and watched it the same night you mentioned it. Good. I'm glad, because a lot of people don't watch the videos about like E&M that I've done, or the sequencing or the fracture follow-ups or anything like that. They don't watch those videos. So I appreciate you watching it. No, Tamara, because again, that's another one that's a technical question. And a lot of times when I do videos about technical things, they don't get views. I've done actually a video on modifier 26 when I was doing Vlogmas a few years ago, and it's still up. You can actually type in modifier 26 and you'll see my video come up with very little views, which is disappointing because I have to do a lot of research in order to bring y'all that information that was in the description box of that video. So if you want to see that one, just let your fingers do the walking and you'll be able to find it. I think I've done it a couple of times. So you have a couple of videos to watch there. Oh, thanks, Liz. Great. That's awesome. I'm so glad about the sequencing. And like I said, I've done videos before, and it's so disheartening when I would see next to no views on those videos. And you guys have to remember something. I am still a YouTube content creator. What you all say that you want and what you watch are two different things. When I was asked before to do an E&M, do an E&M, do an E&M. So I did one on E&M, very little views. There was a book that came out that somebody found on Amazon. It's a great little book, but there's a lot of errors in this book. It's not written by a coder, but it is written by people who write all sorts of testing manuals. So, but it's a great little book because it's got like great little scenarios in it. You just kind of have to watch the answers. And so when I did I said, okay, fine, we'll do a book review on this one and we'll talk about it, the scenarios, and if you guys have any questions. And when I asked for questions, crickets. Nobody was asking questions. And this was very upsetting because this was hyped up for at least 2 weeks that I was going to do this. And people had ordered the book. That book was selling like hotcakes on Amazon. And we were going to go over it. And then the second that I said, okay, let's go. What are your questions? Crickets. So I think what happens a lot of times, and I've mentioned this before, is that people don't want to look stupid. Oh, I don't want to look stupid. You know what looks stupid? Is when you do something and you didn't ask and you're doing it wrong. That looks stupid. Now, if you're saying, okay, look, I did my research. I looked up this and I looked up this and this doesn't make sense. Can you explain it? That's not stupid. That's smart. That's showing that you say, okay, good. I've done my research. What I don't like is when people want to be spoon-fed. I don't get this. Okay, well, what do you not get? I don't get it at all. Okay, so what is the problem? I don't know, Blue. Okay, then I don't know either. I have no idea how to help you. No idea. Unless you specifically tell me. Then I can help you. But again, I need to have known that you did your research. Hi, Priscilla. See, Jennifer found the 26 modifier one. Uh, oh, welcome, Cami. Liz, let me look stupid. I want to learn when I don't know. There you go. Jennifer says, Amen, Blue. You will always be learning something new in this field. Yes, yes, you will. Jennifer says, I put your videos to listen a lot. Oh, that's awesome. Good. Hi, Dottie. Dottie, my name is Bleu. Bleu. So, but yes, so that way you all know. When you are looking up these videos and things like that, if you see them with very low views, I hope y'all watch them because I have to give y'all what y'all want, otherwise y'all won't watch. And the second that I do like technical stuff videos again, nothing. I've done videos about how to study the coding guidelines. That didn't do well either. And then people will ask me, oh, can you do one about the guidelines? And then y'all didn't watch. So I've done one, I've broken specifically down the CPT book, the ICD-10-CM book, the Hicks-Picks book, nothing. So when I do that, that means I get no views. When I get no views, then what am I doing? So you have to remember, I am a content creator. So I am going to want to put out things that you all want to watch. The goal is to get the message out as much as possible. That you have to read the guidelines, that you have to study, you have to do these things. These are your options when it comes to medical coding certifications and associations and things like that. That's the whole goal, is to be able to get y'all motivated to do these things, because it's hard as an adult to stay motivated to study and do all of these things. So that's why I have my channel, because again, I've said it before and I'll say it again. My channel is my mother's legacy. My mother encouraged me when I was in school. I would not be here today if it wasn't for her. Of course, she gave me my life, but she also helped me to get my career. I wouldn't have my career if it wasn't for her, and I will always be grateful. She encouraged me, and now I'm going to encourage you. So that's why I do it. And again, if I have to do an episode about study schedules and how to set one up, because that's what the people want, well, then that's what the people want, and that's what I have to give them. So sometimes as a content creator, I have to do things that you guys want. The whole premise too of the show when I first started it was to talk about medical coding. But again, since those ones didn't get views, then when I started talking about my day, I did a day in life of a medical coder. I got how I got my first job in medical coding, and that's when I started seeing the views fly. So I was like, okay, well, I guess that's what they want. So that's what I'm going to give them, you know. Here we go. Ambrose says, I need to go back and watch your older videos, especially E&M. If both time and medical decision making are charted, which one do you choose? For example, low MDM, but 30 minutes. So that, it goes based on what is most advantageous for the provider. So there's going to be some times when the provider is going to document the time, but the medical decision making is going to exceed. Not in this scenario that you just said, but if it exceeds, the medical decision making exceeds. And let's just say the provider brought the patient in, patient has a fracture. He has to decide to do a surgery on that patient. And so he says, okay, this is pretty cut and dry. It's very simple, 30 minutes. And the provider documents, I spent 30 minutes with this patient on this day, and then they do their time statement. So if you look at, this is a brand new patient, if you look at the coding manual, right, at the CPT manual, and you look under the E&Ms, and you look at a brand new patient, 30 minutes is a 99203. That equals out to a low medical decision making. Well, that's not advantageous to the provider because his medical decision making, or hers, is moderate. I mean, there's more risk with a surgery than there is with coding based on that time. So then that's when you would go with, well, he decided to go for a surgery and he decided to do this for the patient. He read the x-rays and all this other good stuff. So this is going to be actually a 99204 instead, because that's more advantageous and more appropriate for this encounter, even though he said he only did 30 minutes with this patient. You know, does that make sense? Because the videos though, Ambrose, because E&M has had a facelift since 2021. So you have to remember, a lot of those videos I did were from 2019, 2020. And again, I learned my lesson then. So I was like, no more. Y'all don't get any more out of me. And so then that's when I, of course, had done Patreon. So Patreon was at the behest of one of the viewers that was writing in saying, Blue, you got to do a Patreon. And so I was like, okay, well, then that's where I can do all of my coding stuff, because those people are paying for this content. They're not paying to learn about me, even though, yes, you do get personal stories from me that I do not share here on YouTube, but I do share it on my Patreon channel. And so that's how that kind of worked out. So just saying, Patreon, that link, if you're interested, is in the description box below. Tamara says, I've watched many videos, been through Practicode, read the rationales, and it still seems like I need to know the relationship between the provider and the place. I don't quite get what you're saying. It'll come to me in a minute. Susan says, hi, I'm taking coding classes with UT. Woo, woo. I work for them. I just started to, and we're using bucks. Not bucks! Oh, not bucks, not bucks, not bucks. Not bucks, Miss Susan, not bucks. Bucks and me, we don't have a good rapport. I have tons of bucks books. I don't like the way they're set up. That's just me personally. You know, there's nothing against your school, nothing against what you're studying. Most schools will pull the bucks books, okay? I think that's just the way that they have them set up. However, okay, if you're interested in getting another book to kind of supplement, I recommend the CPC study guide. Even though you may not be studying for the CPC, get the CPC study guide, because that covers CPT, okay? And then get yourself the ICD-10-CM and ICD-10-PCS coding handbook with the answers by Nellie Leon Chisen in the description box of all my videos. Not this one, but any of my other videos, you'll hear about it. But get that book. And those two books combined, trust me, they're going to be a lot easier for you to understand. Check your public library if you do not want to buy them, okay? Check the public library and see if they have them, because they may have them, and that'll save you some money. Just saying. Hi, Raining. Susan said, I need encouraging. I feel like I'm teaching myself. That's the way it is, honey. That's the way it is. We are all teaching ourselves. And it is the dedicated student that will get it over time. And once you start relying on yourself, you'll know what it means to be self-taught. And it is a good feeling. And then you'll start to learn after a while whose advice you can follow and whose you can't. Because not everybody who speaks about coding knows about coding. I'm just saying. Lee Anna says, I already started the CPC courses. Am I able to attempt the CCS if I also take an inpatient coding course? I worked 20 years from revenue cycle and from registration to billing to pre-certifications. If you want to, but you know, it's up to you, Miss Leanna. If you want to take the CCS instead of taking the CPC, you totally can. After you've taken that inpatient coding course, though. Raining says, I decided to go with the AHIMA courses. I'm going with the anatomy, physio, medical terminology, patho, pharma on my own, though, just buying the books AHIMA would use. Liz says, I think I get more confused by the number and complexity of problems. The number and complexity of problems, so if something is affecting that patient's care, then that's when that needs to kind of come into play. The number of problems, how many problems is this provider addressing, and what are they doing specifically for these? It's not something to get hung up on, you know. Think about it logically. What are they doing for this patient? Are they managing their medications? Are they sending them for surgery? Are they sending them for PT? Are they doing all these things? Because you can have a bunch of conditions, right? But if they're not doing much, and if they're just saying, okay, this is stable, this is this is that, it's not going to go up very much if you're not reviewing radiology and doing additional ordering of tests and things like that is not going to go up if they're not documenting that they manage, you know, their medications or, you know, any of those things. So you need to look at what they're doing. It's more of like a whole thing rather than I'm just getting stuck on the number and complexity of problems, because it's so much more to it than that. A patient can come in with a lot of issues, but a lot of those issues are maybe managed by other people. And while they're affecting that care, what did the provider do for that patient for those conditions that they're treating actively? And how did those other conditions impact that patient? Like the patient who is a diabetic and who has uncontrolled diabetes, and this patient needs to have a surgery because they got a fracture. Do you think that that provider is going to be able to do that surgery because that patient's out of control with diabetes? No. Why? Because it's an increased risk for that surgery. So they have to wait for their blood sugar to normal out. And so because of that, that impacted their decision making. So that's what you need to kind of look at in the whole grand scheme of things. What impacted their care? Did they have to review labs because of that condition? I mean, obviously you have to look at the sugars, you know, and so did the provider document that? That's going to be in that middle column right there in the number in the data to be reviewed. So if they ordered additional tests, you know, if the patient is a smoker and their use of smoking also affects their ability to be able to heal, again, they have to run a test on them to see if they are actively doing that. And if they are actively doing that, again, that impacts their ability to be able to make decisions on that patient. They can't just send them to surgery because of that, okay? Or they can't just send them for therapy, okay? Those are things that you have to think about. It's more than just one category. You can't get just stuck on one category. Where are we at? Bambi's says, it's not for nothing. It never occurred to me to go on YouTube for help. And now I found you. I'll be watching your older videos. Thank you. Ambrose says, yes, it does. Thanks. Susan says, I'm having a hard time to help. LOL. I work for UT Health Houston. Thanks for the advice. Well, you're welcome. Liz says, I hate that Bucks only gives you half of the answers. Ahima does that too, and I hate that. I hate that about those books. Morgan says, I have a master's degree in public administration. Is medical billing and coding a good mid-career change? I work for the federal government full-time. I'm interested in utilization review. Utilization review is normally done by nurses, though. That's not done by us. If that's something that you want to do, that's something that's out of my wheelhouse. But master's degree, I mean, it's you could do a lot with a master's degree, and you want to do coding, you could still do good. You could still do good. It's still a great mid-career shift. A lot of people do it. The thing about coding is that it welcomes people from all stages of life, from those who just graduated high school or got their GED, and then they just decided to go ahead and go into something like medical billing and coding, or those who are empty nesters and, you know, their kids have left the house and, you know, now they want to do something for themselves and they get into coding and they love it. Those who have hit retirement age and they're like, I'm not ready to stop working. I want to do another career. They have another 10, 15 years still left in their working life, so they go for it and they're still doing it. So if this is what you want to do, then by all means you go right ahead, you know, but it's going to take some commitment. It's just not going to be handed to you. Nothing will be. Nothing in this industry will be ever handed to you. This is about as good as you're going to get with the straightforward advice that I give. That's about as good as you're going to get. You have to be willing to be told no, because you will be told no in the beginning. Once you get your certification, say you go through the program, right? Or say you self-study and you get all the way through and you get your certification. Okay, great. Now you're out there, you're thinking, okay, now the world is my oyster and I get to go anywhere, I get to work and do anything because I have a master's degree and I've got all these things. Well, you know, like you say, you work for the government. They love their degree holders. So I'm just saying, But with that said, now you're bringing this knowledge and then you're bringing the coding knowledge. So what are you going to do with it? Make sure you have a good resume, because you don't have experience, they're going to look at that. But you have to give them something that they want, which is on your resume. What are you telling them? I don't want to know that you have a master's in what is it, public something or another, public administration. I don't need to know that. What did you learn in the school? That's on your skills list. And your skills, you should not have team player. You should not have organized. You should not have a smiling face on there. I've seen that, unfortunately. And to me, if I see something like that, it's immediately in the trash can, because you didn't give me what I need to know. What are your skills? ICD-10-CM, CPT, HCPCS, ICD-10 PCS if you learn that. Medical terminology, anatomy, patho, all of those things. That's what I need to know. Not any of this other tomfoolery. Don't give me that. Just give me what I need to know. Get to the facts. And you know that. Having a master's degree, I know you wrote papers. I know you wrote papers. So you know that you have to get right to the point. They like conciseness. That's what these employers need. They need conciseness, because a lot of times too, the thing I don't talk about is the people that are doing these hirings, right? These are people who have degrees. These people who have degrees in health information management, right? Or health information technology, they are in a managerial position. So what happens when you get into the managerial position? You're taking care of your people, which puts a lot of the coding and all this other stuff on the back burner. They know what they remember from school or from working in coding. So that's what you need to tell them, so that you can start speaking their language. And this is good, advice for anybody that's trying to redo their own resume. And I tell you all the time, y'all can redo your own resumes. Although some of you tell me, no, I can't. It's not that bad. It's not that bad. So, but that's my advice anyway. And keep your resume to one page. 1 page, 2 pages, okay. Because I, as a resume writer, I've done 2-page resumes, and it's fine. However, when you see these people on LinkedIn and they're so proud of their 3, 4, 5-page resumes, and they're like, oh yes, I have all of this. I don't know why I'm not getting calls, because you have a 3 or 4, 5-page resume. I don't want to look at that. It needs to be quick. It needs to be concise. And that's the way these employers like it. They want conciseness. And that's just what I'm going to say about that. What is the difference between CPC and HIM? Look it up. Jennifer says, my program used bucks. Most do. Dottie says, where'd you go? Oh, can you do one on how to set up a study schedule? I'm sorry, I misspelled your name. Are you messing with me, Dottie? Are you messing with me? Legitimately, I'm asking you, are you messing with me? Because I have done this video before several times, and I actually did it a couple of weeks ago, where I said how to set up a study schedule for medical coding. So, and I've even posted the templates too on my Instagram, on the community tab for YouTube, on my Facebook page for Medical Coding with Blue. I've even posted it there. It's a study template with the hours. And these are just sample hours. And I've also broken it down in the video about like what you should study and that kind of thing. And then even on the independent study syllabus on how much time you should spend on each subject, like broken down by like months and weeks. I'm just saying. Hi, Alexandria. Favorite says, I have a, okay, wait a minute. Am I going back up? Am I doing it again? Oh, okay. So Favorite says that they're doing utilization review in corporate for a hospital. Thanks, Raining. You're welcome, Liz. Raining says, Blue, would you recommend a study guide? Again, are you messing with me? Are you messing with me too, Raining? Really? Jamie goes, I got my GED and went straight through college and got my CPC. That is awesome. That is really awesome. Jamie says, I was older when I went back and got my GED and my associate's degree and my CPC. You see, that's amazing, because I also got a message from somebody that was asking, is a GED necessary, or do you have to have a high school diploma or GED in order to get certified? You do, because even when you look on the requirements, it does say that you need a high school diploma or a GED. But think about this. You can't get there without knowing all of that other stuff, without knowing all of your other subjects in for like your GED. So let's just say, for instance, you didn't finish high school, and let's just say that either you were too smart for high school or something happened. Things happen in people's lives, and I don't think that the GED carries a stigma like so many people think it does. I don't think it does. I think that when people get it and they move on, like how Jamie did, and how she took that and she let it unlock those doors. She has an associate's degree now, and she has her CPC, and she's got a really good job. Come on, guys. So it is possible to get from your GED and then move on and go to college and do great and wonderful things, because there's people who have high school diplomas that don't do anything with them at all. They don't even go to college. So that's something to think about, guys. Everybody's road in education is different. And so if you are like on the fence, or like, oh, should I get my GED, or should I pursue this at all? You're going to need it. If you do want to go through it, you do need it, because it's not just, okay, if I can get through this part and not have a GED, okay, well, all of a sudden I have a certification. Well, guess what? When you go apply for these jobs, they're going to do a background check. And guess what's going to happen when you cannot produce a high school diploma or a GED? You're not getting the job. Or let's just say that they're doing a midpoint review, and then they run a background check and they see that you don't have a high school diploma or a GED. Well, guess what? If the employer is nice, they'll say, okay, get your GED and then come back and let us know that you got it, or they'll just fire you for lying. I'm just saying. And a lot of you are stopping and not doing the GED because you think that, no, I can't pass it because I have test anxiety. What do you think this test is going to do to you? I'm just saying, what do you think this test is going to do to you? This is going to involve 3 different manuals at least, and then advanced medical terminology and anatomy. So if you're on the fence, I'm telling you, you should do it. And I told that lady who was asking me about it that she should do it too. She just said that she wasn't sure that she should invest her energy into doing that if the GED was going to be required. You just can't tell people. You can't explain things to some people sometimes because they want to know or hear what they want to hear. And unfortunately, that's the case. So, so sometimes if you don't get a response from me, I can't say anything to you, because sometimes just the response, I know what I'm going to get from that response. Liz says, Bleu is the queen of tough love and shoots straight from the hip. Romy says, I applied for a CDI position and I wasn't really expecting, where are we at? Okay. And I wasn't really expecting a response, but I ended up having an interview, which went horrible. And a couple of days later, my references were contacted. And a week later, I was offered the job to my surprise. I can't believe it. If you don't apply, the answer will always be no. When you apply, as Romy just proved, you never know. And even though it went horrible, I think not. I think not, because clearly they liked you enough to call you and offer you the job. I'm just saying. Jimmy says, oh my God, Bleu. BLEU. I started coding class, and at first it was a lot of information, LOL. Favorite says, the thing with utilization review is that there are LPNs and RNs that work utilization review. I am either. I am a coordinator, but I still do... I am either or I am neither. I am a coordinator, but I still do a majority of what those LPN and RN duties are. Gotta be careful there. Yes, she has a video on study schedules. Jennifer says she has many, many videos on setting up a study schedule. Crystal says, good job, Jamie. It takes a lot to go back after leaving school. I did the same thing for my GED, and it was my journey to my CPC. There you go. I think I need to do a video about going from the GED or high school diploma to a medical coding certification. I think that would be good for people. Camille says, thank you for all your advice. Looking to complete medical coding. I have been a claims collector for 20 years. Okay, Raining, you'll be forgiven this time. But I do have that video. I'm going to take that as a yes. That's an absolute yes. Jennifer says, I got my CPC and I'm in my mid-40s and I'm proud of it. There you go. Lots of congratulations for Jamie and Romy. Alexandria says, my older brother quit high school in his senior year, graduated the Marine Corps, or joined the Marine Corps, and is now a high school equivalent certificate and a college degree, and went to war 2 times. You can do anything. There you go. Morgan says, thanks. I'm researching other fields. Mid-career will be 60 in a few months. Researching my best options with the degree and experience. Public health may be a better route. Just checking my options. Desert says, hi, Blue. How long do you recommend working in a facility before you work remotely? Thanks. So, I mean, I say at least a minimum of 6 months. I really wish y'all would do a year, but, you know, again, at the risk of being yelled at in emails later, oh, no, I don't know. 6 months, I will say, is the minimum. 6 months, okay? This will get you around the people. This will get you around providers so that you know. This will get you around those that can answer questions about the electronic health record for you. So that's something that, you know, is an option. It's just an option. And of course, I mean, like I said, if you waited a whole year, that would be a lot better, because then you'll really be sure-footed. But if you want to do a minimum of 6 months, that's fine too. Favor says, sorry, I was just trying to reiterate and expound on Morgan's comment. Yeah. I didn't say nothing bad. I didn't say nothing bad, Favor. Morgan just came back and said that they were going to be 60 here pretty soon. A lot of people get into this career field later in life. But I mean, again, if you're going to go back for another degree, and this is directed towards Morgan, with the degree and the experience, public health may be a better route. Okay, well, I mean, if that's what you want to do, I mean, you came here and asked me, so. Desert says, thank you for your reply. I want to get as much experience as I can as a medical coder biller. I'm an RN with 10 years of experience, but I hurt my back on the job, so I'm taking a online medical billing and coding course. Crystal says, listen to Blue on when to go remote. I originally wanted to start remote, but ended up with an on-site job and was grateful for it. See, there you go. Flower Power, how much of study time is recommended for 10 months? 20 hours per week. No more, no less. All right, Liz, have a good night. You're welcome. So, but yes. So anyway, all righty. Did I miss anything? I don't think I missed anything. I'm looking back through the comments. Yeah, I don't get it. I don't get it. You know what? I'm going to do you one better. I'm just going to get rid of you. Bye-bye. All right. All right. Let's see. Tawana, when you take exam, do AAPC give you information about joining chapter groups? I guess they do. Desert says, I see where you are coming from, Crystal. That's the only way you learn from the real deal, working on site. All right. Yeah. Yeah, you too. Raining says, I learned so much from you. You truly are an angel. Thank you so much. Alexandria says, listen to Bleu about everything medical coding and studying for medical coding. No, Flower Power, no, because you can go anywhere on my channel and find it. You can Google it. You can go to Facebook on my Facebook group and find it. You can go to the YouTube community tab and find it. You can go anywhere and find it. So no, I will not pin it here. Desert says, oh, and about working remotely, could a medical coder / biller work for companies in other states other than their own? Yes, a lot of people do it all the time. If that company allows for that, then yes, absolutely. Alexandria says, yes, Tawana, and there is a place on the AAPC website that directs you to local chapters. I am an officer for my local chapter 2nd year in a row, and I have been with AAPC since 2020. All righty. Yes, Optum does. All righty, guys. So, whoa. I just looked to see how many people were watching. Okay. So to reiterate, if you are joining late, I am booked out until April the 1st. So if you need a resume, tutoring, professional coaching, like an interview setup or something like that, or you want to talk about the industry one-on-one, my soonest availability will be April the 1st. Okay. So just so you know, I'm completely booked right now. And also from March 4th through the 7th, I will not be on lives. I will still set the shows up for premieres, but there will be a moderator in the audience watching for comments and anything that is deemed out of line will be blocked. So if you have, if you don't notice that I'm there that week, it's just because I'm taking the week off. Okay. Desert says, that's awesome, Cami. Eventually, it is my goal to work remotely, but first I want to get at least 6 months on site. There we go. They do, but they do a lot of the risk adjustment, just so you know, for Optum. So, any other questions, guys? No questions? You can take a peek through my videos for study schedules, for the books I recommend, for the association questions and specifics. Yep, contract workers. Desert says, I really appreciate your videos, Blue. I recently found your channel. You are truly a blessing. There are not too many people encouraging people to become medical coders and billers. Or Cami says they were contracted out, contract coders, I should say. All right. Well, I'm so glad. I'm so glad that it helped you. Glad you're in the audience. Appreciate you watching. And she's taking Penn Foster for medical billing and coding. Now, I've done the videos before about, somebody else asked me to, about the US, what is it? US something, US coding, US careers or something like that. If that was a good one for medical billing and coding, I've already done that one. So if that's a company that you're looking at to get the training, you can totally look through the videos, because I did a review on what they have on their website. I have obviously never been there. I really hate it when people ask me to do those, and like the one for Career Step. I haven't done one for Career Step because I look back to my videos because I don't remember talking about Career Step, but I did do Ed to Go. I don't like doing those ones in specifics because I've never been to the school, so I can't say yay or nay. And everybody has different experiences, and I get so many different kind of comments and stuff like that. So I just don't want to go down that rabbit hole, you know. And there's one in particular I really don't like, and I will not talk about that school, period. You know, so that's just, you know, I'd rather just leave it where it lies. Gabrielle says, I've been watching your videos so much and I've learned so much from every one of them. I appreciate you for sharing your knowledge with us and your tough love. My husband and I love when you giggle. It's cute. Thank you so much. Because, you know, I get some people who actually complain about it and they say, stop giggling. Don't giggle. Don't laugh. Don't clap your hands because it's annoying. Take the sign down because it was backwards in the video. And I will still clap, however, again, my hand. So I'm not going to clap right now because it hurts my hand to do all that. But once this comes off, back to the clapping I go. Charlene says, what program would you recommend to sign up for a beginner with coding and billing? I know you had that video that recommend AAPC. I didn't recommend only AAPC. Let's just be clear there. I've always said there are 3 that I recommend. AHIMA, the American Health Information Management Association, they have their 13-course bundle online. AAPC, they have their program too, and independent study. Those are the only 3 that I can recommend. Okay, so that's just what I can say. Desert says, Charlene, I'm taking the one with Penn Foster, totally online and affordable. I enjoy it. Desert says, giggle all you want. It brightens our day, really. And I will, because I mean, that's what I love to do, you know, so. Crystal says, be proud of who you are, Blue. Don't listen to the haters. I don't, clearly. Because I still do it anyway. And sometimes I will purposely clap extra for the heck of it, because I had somebody who complained that day about it. I will still do it. I mean, I don't care. You know what I mean? If I listened to every single person's complaint about me, I would not do anything. I would just be a still little face, you know, in the camera. Or it would be like moving around and doing all this stuff and edited and stuff like that. That's not me. That's not me, guys. And I've managed to build the channel up from a nothing burger to what it is now by being myself. So what you can do. Yeah, Blue, stop giggling or else. How long have you been doing? I think that second question was for you there, Desert. You must have been hanging out with JR. Now JR is not here tonight, but I think he said he'll be back next week because he said I'll see y'all next week on last night's show. So Gluten, been hanging out with JR too much. I'm just saying. Oh, thank you, Beth. So Desert's talking about the Penn Foster program. And I think I did one on Penn Foster too. And see, Penn Foster, it gets mixed reviews because some people say they enjoyed it and other people say that they didn't enjoy it. So I just put out the information that was on the website and from what I saw and what they prepare the people for, you know. And I told them not to go with certain other certificates, but to go with one of the ones from the major associations, AHIMA or AAPC. Hey Blue, someone said that the AHIMA 13 course bundle is a bit boring with lots of reading and not a lot of videos. It's from what I've heard, it's a lot of slides. And so, I mean, it is what it is. I mean, not everything's going to be exciting. Learning medical billing and coding is not always the exciting thing. If you listen to somebody who says, oh, it's boring. Well, people would say that same thing about AAPC. Or people would say, well, you know, I spent all this money and I didn't get this because the school said this and all this and all that. So you can't really listen to people when they say that, you know. You have to be your own driver in this instance. If you are not committed, from day one to your why. Why are you doing this? Why are you studying medical billing and coding? That's what's going to be able to get you through those times when it's boring. It may have been boring to them, but to other people, would be like, okay, it's just the slides and we just learn from it and stuff like that. You could always supplement these programs with other things that are more stimulating for you, like watching videos, or working with workbooks or coloring books or for anatomy and things like that. So I mean, it's entirely up to you. You are the captain of your own ship in this instance. So again, I mean, it's really all about, like, okay, well, if they say it's boring, well, good. I mean, good for them, but it doesn't necessarily have to be boring for you. Just saying. Let's see. Desert says, yes, you did, Blue. I think I watched it and then decided to go with Penn Foster. Oh, okay. See, there you go. Penn Foster has lots of videos, not boring at all. Somebody asked me too if I was the voice on the AAPC videos. No, I'm not the voice on the AAPC videos. I am not affiliated with AAPC in any way. I'm not certified through them. I will never be certified through them because I'm already with AHIMA. It doesn't make sense to me in my head to go with both associations. Okay. I have plenty of knowledge that I that I've gained, and AHIMA is just fine for me, so no, that is not my voice on the AHIMA on the AAPC videos. Just say it. Desert says, I'll tell you what, nursing school wasn't fun. Whoever is a nurse here can agree with me. I don't wish that on anyone. I could have gone to get my nurse practitioner master's, but I am really burnt out from all of it. And you know what? That happens. I totally get it. That happens. So medical billing and coding school sounds like fun to me. I just have to get the books. Is anyone using the books without any one program? Leanna says, Grandma used to say, if you want exciting, double dip. Oh, yeah, that would be exciting. That would be really exciting. That would be very exciting. But yeah, what are you going to do in that situation? So, but I can give you the codes for it. So anyway, with that said, it's all up to you what you do and what you make of your journey. If you choose to make it boring, it will be boring. If you choose to see it as a chore, it will be a chore. It will become a chore. However, if you choose to go and look at all these other options, I've talked about alternatives for learning too as well, with the crossword puzzles and the word finds and the coloring books and the videos and listening to things and looking at the pictures and getting those visual stimulus and things like that. If you can do that and change it up for yourself, you will be more successful than the person who says, oh, I gotta learn this again, I gotta do this again, I don't want to do this. And then it becomes a chore. But if you're committed and you want to do this, then it will be easy for you. When I was in medical coding school, I went to a trade school. It's no longer there anymore. But when I went, it was, you were sat in front of a computer and told, learn, here's your books. And my incentive to get to the next class, because it was self-paced, the incentive for me was every time I went to a new class, I got a new set of books. And so I'm all about books, okay? So that was my driver. I was like, ooh, I get to get new books. And I was so excited to get my coding books. And it was ICD-9 at the time. And so I was so excited to get all my books because they had the shrink wrap on them and everything. And so I was excited about that. So that was my goal every single time. And so it was just like, it was just easy for me because I'm a reader at heart anyway. And so that was what was good for me, was that I was reading and, it was something that I loved to do anyway. And then of course you have to bring in like medical terminology and anatomy. I'm like, what am I learning? What is this? But that's what you do when you're learning, and you make it whatever you want to make it for yourself, And again, not everything is going to be the most exciting. There's things that I find very boring at work. But I would not trade it because it's part of the package. It's part of what you do. I'm just saying. Priscilla says, reading is a big part of coding. Yes, it is. It absolutely is. Desert says, Don't do that, Gutenberg. I called you gluten. My bad. I don't know why I saw gluten bird. Gluten bird. And then Tester says Gutenberg. No, that was bad, okay? It's Gutenberg. Gutenberg. That was my bad. I am so sorry. I've been calling you gluten the whole time. You should have said something. It's not gluten, Blue. Let's see. Just join the online class. It's not as easy as you might think. Anatomy and physiology, pharma, those are no joke. I don't even know about the coding part. Raining says, they all give you what you need. I believe you need to take the information and make it interesting. Yep. Jennifer says, Blue, just curious, have you ever heard of an interviewer expecting you to be able to call out CPT codes without looking in a book? I experienced this recently and my mind was blown, LOL. Maybe it's time for a snack, Blue. Yes, actually, I did. On my interview here for my forever home, I wasn't expected to call out the exact code, but I was expected to know what the range was, because I was asked, what is the 20,000 series? I was like, and I said, like looking to the, I was like, oh, it's the musculoskeletal section. And she said, okay, that's good. And so I was expected to know those things, you know, but I was just like, oh my gosh, I don't know like the sections of the book. And so after that, I made sure to know what the sections of the book were. But to call out specific procedure codes, I mean, I can do that now, but that's only if it's like, if you ask me about like common procedure codes for like for ortho, I could do it. For podiatry, yes, I could do that. But that's like common clinic procedure codes. I can do that. Not some of the other surgeries. I can't name like fracture reduction ones, or you know what, the ones for ACL repair. I can't do that off the top of my head. I know what the range should be, but I can't do it off the top of my head. That's a little weird. But I guess, you know, whatever. They want to see what you're made of, you know. Jennifer says, that is what I do to be able to that is what I was able to do to the series. Yeah, the series. You can do the series. That's easier than actually specific codes, because you're not an encoder. You know what I'm saying? So I don't know. But anyway. Go to the website. Go to the website. Go to the website. Go to the website. It's on there. Desert says, one more question. About the specialties, how long should we work in general practice before going into a specialty? And what specialties do you recommend? Is surgery a good one? Surgery is absolutely a good one, but surgery is where coders are made. Surgery is honestly where coders are made. But you don't necessarily have to go into general practice. I mean, there's really kind of no such thing as general practice, unless you're talking about family practice, which covers everything. But again, then you're exposed to all specialties. I've done a video before about like good specialties for brand new medical coders to get into, to gain lots of experience right away. So if you work in the ER, you get to sample everything: neuro, ortho, mother baby, podiatry, peds. You get to do everything in the ER because you see everything in the ER, right? The ER, urgent care, these are fantastic places. Even family practice. Family practice is also great too, because it's not just E&M that you're seeing there as well. And the ER, you're seeing like hydration and other procedures, but in the ER, in the family practice, you're seeing like well woman, well baby visits too. You know what I'm saying? So that's in some places, not all, but in some, they have that. So you get lots of exposure there as well. So those are 3 great places to go to get you sort of a sample of everything. Inpatient professional services or professional fee services, that's also a great place to sample everything, because you're getting all of the people who are staying in the hospital, but you're ensuring that the provider gets paid. So it's all outpatient coding, even though the patient is inpatient in the hospital. And so when the patient is inpatient in the hospital, it's outpatient, but it's inpatient. And again, you get variety of everything. When I worked before I got here at the hospital that I was at, I did professional fee, and I coded for psych, for mother baby, for ortho, for the MICU and the ICU. I coded for what is it? I already said OBGYN, but I coded for gastro and urology. I did all of those, and cardiology. Cardiology. But I did those, and I mean, that gave me such a well-rounded experience for here. And that was how I was able to get this job here, was because they saw I was a professional fee coder. And so they knew, and that was where they needed me. And so that's where I got in. And so when I went here, then I got moved, after a while, I got moved to behavioral health. And then I did the TBI clinic. And then I did just a series of other things. I did physical therapy. I did that one. I did occupational therapy as well. I helped out in urology. And then I got put into ortho and podiatry. And that was my forever home after that. And so then I got pulled to help in other places. But I've been everywhere. I mean, I've coded everything. And I'm a strong coder because of it. There's nothing that I fear, because it's just a matter of taking a couple of days, even as a veteran coder, taking a few days to learn it, to get yourself acclimated to it and like the procedures and everything. And then you're off and running, because your certification says that you can code for anything. Your certification is not limited to just general practice. It is for everything. You're tested on every single specialty. So don't ever limit yourself, whatever you do. Leanna says, I found you. You're absolutely delightful. Thank you so much. Desert says, I worked in the OR as an RN. It's in a world by itself. Yes, it is. Jennifer says, yes, I love the ER. I now do trauma cases, and it's very interesting. Yes, awesome. Okay, great, Desert. I'm so glad. Awesome advice, Blue. Gutenberg. There we go. I got the 2024 CPT book and the ICD-10-CM from Optum. Would those be used in any program? Yes. Is the CPT book by the AMA, the American Medical Association? Desert says there is also dentistry, but there are so many options as a coder biller. Yes, there is. But in dentistry, the CDT, or the procedures book for dentistry, is the current dentistry terminology. I think that's what it is, CDT. That's managed by the American Dental Association. They have a lock on those codes. That's why you don't see practice books for the CDT. I'm just saying. Gabrielle says, hi, Blue. I was looking at a course to take. I found one that has everything I need to learn and take the CPC, but they don't have understanding pathophysiology or pharma. Then get the books and learn it on your own. It's not that hard. You just follow the workbook and you'll be fine, you know? Is it something that I can learn on my own? Yes. Yes, it is. You must be also new to my channel. Yes, it is. I have the independent study. I've always said the 3 that I recommend: AHIMA, AAPC, and the self-study. You can self-study because none of the 4 main medical coding certifications require you to go through a formal program. You just have to know and make sure that you're taking one that you've studied for. So the CCS, the Gold Standard of Medical Coding Credentials, CCA, both cover inpatient and outpatient coding. And you have to know ICD-10-CM, ICD-10-PCS, and CPT. You have to understand about MSDRGs and DRGs and all the other good stuff. So it's a lot to those 2. But if you only want to do outpatient, which most new people start off in just outpatient, you have to know about ICD-10-CM, CPT, and HCPCS, and you can choose between the CCSP, that's with AHIMA, or the CPC, that's with AAPC. So there's differences in the associations and what they charge and things like that and how to maintain. But It's up to you, whichever one you want to go through. But you can study for any one of these four, and you'll be just fine studying on your own or going through a program, whichever one you want to do. Desert says, there are YouTube channels on anatomy, physio, and pharma. You just have to look and see which ones you like better. Crash Course is awesome. Crash Course is awesome for all of those. Gabrielle, you can, but I wouldn't recommend it. I mean, if you have the stamina for it and you follow the study guide that I have, you'll be fine. If you don't, then you'll see the results. If you don't follow it, or if you don't stick with it, or if you don't follow the instructions of that independent study. And it's in the description box of other videos, not this one, because this is a live. So you go to any of the regular videos that I have, you'll see the link for the independent study that's there. Yep. Jennifer Crash Course. Alrighty. Okay. So guys, I'm gonna go ahead and wrap this one up because now my voice is starting to go and I don't want to start coughing. So I'm gonna go ahead and wrap this one up. But I will be back for shows from the 26th to the 29th. So remember, in March, from the 4th to the 7th, no Bleu. Okay? But there will be still shows during that week. So mind your manners, encourage each other, take care of each other. And then I'll be back because there will be a moderator watching. Oh, Netters is awesome. I love Netters. There's no excuse for not learning. You're welcome. Thanks, Crystal. Looking forward to the next video. You are much appreciated. Thank you so much. All right, guys. If this video helped you, please like, subscribe, and share, and I will see y'all next time. Bye.